commonly performed with IVF is preimplantation genetic testing, otherwise known as PGT. There are different kinds of PGT that can be done to test embryos. PGT-A stands for PGT aneuploidy, and it's the most common kind of testing done to check that embryos have the correct number of chromosomes. This checks for sporadic or random chromosome errors, such as trisomies and monosomies, like Down syndrome. PGT-M stands for PGT for monogenic disorders, which is to screen for a specific disease known to run in a family, like cystic fibrosis or sickle cell anemia. If an individual or couple has had testing done to see that they carry a disease, PGT-M can be done to screen for an embryo for that particular disease. PGT-SR stands for structural rearrangement, and it tests for an embryo if it has a translocation, imbalanced translocation, and that would be done only if an individual parent was known to be a carrier of a balanced translocation. In summary, there are three kinds of PGT testing: A, M, and SR. They can be done alone or in combination depending upon your particular genetic situation. PGT-A is the most common kind of genetic testing done on embryos, and it is most important to consider doing PGT-A with increasing maternal age, especially over the age of 35. This is because the incidence of aneuploidy is higher with increasing maternal age over 35, and data has shown that PGT-A is most effective in women who are over the age of 35 to 37. PGT-A is typically performed via trophectoderm biopsy on an embryo around the 5th to 7th day of development, when the embryo has reached an expanded blastocyst stage. So the embryo is cultured in the lab and then biopsied by the lab member, and the biopsy is tested for the genetic testing for PGT. It takes a few weeks to come back, and the report is generated by the lab. The patient and the doctor reviews the results, and we decide which embryo to transfer. The benefits of PGT-A include screening the embryos for aneuploidy to markedly reduce the risk of transferring an embryo with an abnormal number of chromosomes. PGT is a screening test, and so it is not 100% effective, but it is exceedingly effective in screening out embryos that are abnormal. PGT may also have the additional benefit of reducing time to healthy pregnancy and potentially may reduce the risk of miscarriage.